Welcome to Now Serving, a Side of Therapy, your intro guide into the therapeutic world. Together, we'll explore various aspects around how to show up for ourselves and others by tending to our own mental and emotional well-being. I'm your host, Dalton Huckabee, a licensed marriage and family therapist, and I'm grateful you've joined me. Welcome to this week's episode of Now Serving, a Side of Therapy, a client's introductory guide into the therapeutic world. Today, we're joined by Nathaniel Silveira-Pyzik, who is a licensed professional clinical counselor and board-certified dance movement therapist. He has a private practice in San Carlos and specializes in working with adults, teens, couples, and supports clients through a wide range of mental health and relational challenges. Nathaniel's passion lies in offering workshops on the transformative power of dance movement therapy for mental health, nervous system regulation, trauma healing, and overall wellness. A member of the American Dance Therapy Association, Nathaniel blends his counseling expertise with creative, body-based approaches to help people reconnect with themselves, release tension, and discover new pathways toward healing and growth. Welcome, Nate, to this week's episode of the podcast.
Hi, thank you for having me.
I'm so glad you could join. In one of our earlier episodes, the licensed clinician, she does yoga, and I was mentioning to her then, where we were talking about this interest in idea of around incorporating movement with therapy, and now we came across your profile, and this is exactly right up your alley. So it's like coming full circle here. So I'm really stoked that you're here.
Likewise, it's a great modality to incorporate, and it's a creative arts therapy. So, I'll start off by sharing a little bit about what dance movement therapy is in case people aren't aware of it. The current definition, according to the American Dance Therapy Association, is the psychotherapeutic use of dance, movement, body awareness, and embodied communication to foster healing and well being for all individuals, families, and communities. And the key word being psychotherapy. A lot of people have heard of expressive dance or movement practices, but they may not know that there's actually a form of therapy that they can use to treat a variety of mental health issues or even physical issues, or just to express themselves emotionally. It's under a group of therapies called the creative arts therapies, and that includes art therapy, music therapy, and drama therapy. But what a lot of people may not know is that it's not about learning a specific dance technique in itself, although certain movements can be therapeutic, that a dance therapist might guide them through. But it's more about the expressive nature of the dance or movement and how it makes a person feel. All movement is meaningful, and there's no right or wrong way to move.
Yeah, so you don't have to worry about executing a particular choreographed routine, right?
That's right.
Yeah, I like when you kind of introducing this aspect of creative arts because it's a nice alternative to talk therapy, which I imagine that you also utilize, but it's for persons who might want to be able to like express themselves in a different way, like you said, through art, right, or through music or through movement, right? This is another alternative that's great to explore.
That's exactly right. Sometimes people don't feel like talking or they don't have the words to express what they're feeling. And so by getting into their body and noticing how they're feeling on a body level, and then trying out other ways to process what they're feeling through journaling, movement, art making, being in nature, all the ways that we experience our senses can be pathways into healing and growth.
That idea of like reconnecting mind and body, right? There's mindfulness can get a lot of press, right? But it really has like some real tangible aspects too, in that um it it's my experience, right, that a lot of people might be living in their heads, right, and they'll have that disconnect with their body. And here's the thing, right, like whenever we're thinking about like the future stuff, like unknown, right, or yet to happen, it's like that's anxiety, right? And then maybe even some stuff that's happened around in the past, right, that could be related to depression, grief and loss, if you will, for example. um but um but the thing is that the mind will do that. The body won't do that. So to your point, if we can tap into our senses and enhance that mind body connection, it can help us feel more grounded.
Exactly, it's a great point. The body remembers, and also our movement repertoire remembers, like the way we show up in relationships, the way we behave, the way we respond to stress, and day-to-day life activities. Um, in therapy, we can talk about our symptoms and what we're, thinking and feeling, but then to get into our body and relate it to fully connect our mind and body, that can be really effective. And people may know the term mindfulness, but there's also a term called bodyfulness, which is about the full body experience and what we sense, and not just thinking about, you know, things and how we do things, but what actually is happening on that level. And we're naturally, moving through the world, like trying to make connections. So the brain is processing, making new wiring, neural connections. And so when you interact with someone and you have a relational experience, that can be really transformative. So it's a dance movement therapy is a really action oriented therapy. It's not just talking about it. It's sometimes involves words and verbal processing, but it is much more dynamic.
That term bodyfulness, like that seems, I haven't heard that before. Is that a fairly new term? Do you know?
I first heard it from a dance movement therapist who's a professor at Naropa University in Colorado. She talks about the term bodyfulness,
We're
which
already like talking about this, like, enhanced connect mind body connection, right? That DMT offers. What would you say are some other benefits of dance movement therapy?
one of the main benefits I see a lot is the emotional release. A lot of people, describe their emotions with words, but then when they actually get to release it, any tension that they have in their body, and express it through a gesture or a movement or even a dance phrase, that can be really powerful and can be seen on a deeper level. And also improving mood. So when people move their bodies, when they exercise, of course, and you get release endorphins, you feel better, you improve your mood. If we're, of course, stillness is also something, when we're meditating or when we're resting, that's also helpful as well. But to realize, you know, that how the movement made you feel, that can really improve mood. It can also reduce stress, and increase social connection. When you see other people moving with you, doing different movements, that can help you feel seen and connected to others. And as you said, mindfulness, kind of is what a lot of people think of. But this can also be an active form of meditation. So it can help improve focus, cognitive, and mental abilities. So it also can improve mindfulness as well.
Yeah, I was even reading something earlier about when we can like get into this ruminative state, right? Kind of thinking and thinking. People might kind of tend to think about that as like overthinking, right? Um, and what I was thinking was that it that can tend to happen, like usually, like when do people usually say that happens most? When they lay down and go to sleep at night, right? Is like when their head just goes and goes. And so the thing is that the prefrontal cortex which is kind of responsible for like establishing that logical reasoning, right, is tired at the end of the day. And so that's why there might be this tendency to engage in, the hamster wheel, as I call it, right? Because the prefrontal cortex is a little bit tired at the end of the day. And so people are just kind of like still like looking for these answers, right, in their head. And or it could just even be about like anything like non-stressful too, right? Just kind of thoughts that are churning. And so, like you're saying, kind of engaging in this mind body bodyfulness, right, as it were, right, through DMT can help kind of calm that anxiety and reduce that stress.
That's absolutely right. I always tell people, listen to your body. What are you sensing? And then how does it want to move? If you have the opportunity to get up, stretch, go for a walk, that can help shift the perspective of what your thoughts are, how they're influencing you, and how you're feeling in turn. So sometimes it's about redirecting yourself, noticing intuitively or what your instincts are, what your impulses are, and then helping clients when they come into my office, help them modulate that experience or see the range of movements that are available to them or coping strategies that are available to them so that they can feel better, whether it's reducing stress, improving mood, releasing anger. Anger, that can be a difficult emotion to work with. But dance movement therapy is great for dealing with some of these more difficult emotions.
And I know it might be hard to exemplify right through this setting that we're working with here. But is there like, do you have like a brief example of like how someone might be able to like kind of move their body and to kind of like as you're talking, I was wondering about that.
Absolutely. So if someone's really anxious or in their head, right, I might just have them do a movement scan to feel their body parts and like feel like, okay, like get a sense, a physical sense, maybe like tapping or place just kind of like, you know, touching different parts of their body, kind of to wake it up or feel that, proprioception, which is the feeling of your skin, right, and your body boundaries. Also, shaking movements, shaking out parts of your body, using your breath to release tension. Um, I have a few like clips on my Instagram page where I show like how different movements can sort of emulate or make a person feel a certain uh, shift their mood or make them feel a certain way. And of course, that's just one example. And everyone experiences it different, and different movements mean different things to different people. But I offer people kind of a sample or different guided movements to try out, and then they feel what's right in their body, and then they create their own movement phrase or dance phrase and meaning, and then we explore it together.
Nice. And so, yeah, so you have an Instagram page, right? It sounds like there's some examples of that, what that might look like posted there. So people can feel free to check out your Instagram page as well. Like you started to talk about like getting into tapping and doing a body scan and things like this. Can you just describe a little bit more about like what a session would look like with you?
Absolutely. So, yes, it's dependent on the particular client, what they're coming in with, what they're wanting to work on, also the setting. But for the most part, if a client wants to do dance movement therapy, and we've done a little assessment on what their goals are and what some of the treatment concerns are, I'll assess for like their physical limitations too, and encourage them to do movements that feel physically safe, emotionally safe, and modify the movement, because the most of the time the movement's coming from the client anyway. It's not me like teaching them a specific technique. But that being said, I will start with a movement warm up and checking in with how they're feeling, and then doing starting with different maybe like directional movements in space, some stretching, some notice like how big movements and small movements feel, and notice how our breath makes us move when we take a deep breath. And then we might start to do some rhythmic movement, like you know moving our feet, maybe with our hands too. And then eventually we develop a theme depending on what the client's coming in with, what they're feeling, or what they're dealing with. And that theme can be um, translated into movement literally, like, okay, what did you do? And so let's like reenact that. Or it could be like more metaphorical or more abstract. And then through guided imagery prompts or their own imagery that they create, it can create a theme, and then we can repeat that, see if we want to grow that or develop that, and then we'll have a closure or verbal processing oftentimes about what that meant to them and what might there be new insights that they have that they gained that they can take with them.
Nice. Yeah, we always like those takeaways, right? Like things that they can practice on their own. And so as we've been talking about like some of the benefits, right? And getting into a little bit of the actual practice, like you were just talking about, right? Something that comes to mind for me that I really like to go over with when we're talking about like modalities and the efficacy of things, right? Is like research, right? It's like people might wonder, okay, well, what kind of research is there, right? To kind of, you know, make this kind of approach valid, right? So, so I was just kind of curious. Do you know if there's like any research that's been done on this topic?
Yes, I'm so glad you asked that. So dance movement therapy is a growing field, just like all the other creative arts therapies, and it's actually been around officially since the 1940s, when early dance movement therapists were using it in psychiatric settings and documenting their work. Over the years, it's expanded to different populations and settings in different communities and in private practice. But the American Dance Therapy Association, which accredits dance movement therapists and um, supervises them and teaches this, trains people in this therapy, does a lot of research, and they have done research on a wide variety of populations, including patients with dementia, schizophrenia, depression, autism, and also the overall health related psychological outcomes for a variety of physical conditions. I work a lot with clients who have anxiety and psychological trauma. So there's a lot of trauma research out there that affirms body based practices such as dance movement therapy or DMT, and how it can help them process trauma, reconnect with themselves, especially since feelings and memories are stored in the body even after the mind dissociates from trauma memories. So we can find new pathways or new connections in to safely process trauma. Some people might know about EMDR, somatic sensory, somatic processing, or even yoga has been seen as a great tool and um, body-based practice for healing trauma. So there's a lot more research to be done to really be recognized more generally, more broadly. But there's a lot of research being done. You can check out www.adta.org to learn more.
I'd be amiss if we didn't acknowledge like how dance is actually like been around for a long time, right? Like, and so in tribal communities, right, historical times, right, and so can you talk a little bit about that, about like kind of like the history of dance and the importance of that and how that kind of translates to where we are today?
Dance movement therapy, yes, even though it's a newer field, it's important to acknowledge the fact that dance and movement as healing practices and spiritual practices have been around since the beginning of human civilization, and indigenous peoples and various cultures have used dance and movement and continue to. And so the field can learn a lot from those practices in history and be inspired, take it as inspiration for future work and working with clients across the world. So, you know, dance movement therapy in the States is also only one aspect of how dance movement therapy is seen around the world. And so it's really cool in the research, and we're getting a lot of great evidence about how it's used, because it's an art form as well as now a science and spiritual and healing practice. So many ways it can look, but there's a lot of commonalities and universalities that we can look at.
When you talk about some of the benefits having a social component to them, right? How this aspect of dance and movement, when we look across those kind of historical times, right? It's all about kind of like uniting and coming together. And it's like celebratory, there's a particular intention around it, right? And meaning. And so being able to, like you said, kind of put the phone down, right? Get the phone out of our face and like go get in your body.
Yeah, and then how much easier it is to relate to people and connect. Like a lot of this work is being in connection with other people, and how much we as humans crave social connection and need that, is so important. So whether you're working individually with a therapist, and yes, there's so much more you can explore on a deeper level, with one-on-one interaction, of course, and you might feel safer to talk more personally and move more personally, but the power of a group, supporting each other and having a safe space for that and being in community is so important, something that might be missing more so nowadays.
Yeah, and I also see it as this opportunity to tap into like this intuitive sense that we have, right? It seems to me that with the advent of technology and all these things, right? Like we maybe have gotten away from some, not 100%, right? But to a certain extent that we've kind of lost touch with this innate ability to want to move, to express ourselves, and getting back in touch with that again, establishing that mind body connection also helps us put us in touch with ourselves around like this intuitive part that we have that may also have like gone overlooked because of all of these like external distractions.
Definitely. It's a great point because technology has, advanced us so much. We have lots of new skills, right, from that technology, but also it can, I believe, hinder our innate sense of intuition, instinct, and put over us a layer of judgment and criticism. I work with a lot of people who have a lot of judgment about moving in their body comfortably and naturally, and criticize like how it might look or how might people judge them or perceive them. And of course, that's natural. We all have, I've experienced that, I'm sure. I help people find appropriate, socially appropriate ways to navigate that and give them, at least even if it's a private space, to tap into that creative, expressive side that's not hindered by judgment.
I'm glad that you mentioned that because I was watching this video the other day on Instagram, and this guy was just like, I don't know, I think maybe it was in New York or something. I can't remember. But this guy was just like out on the street, like just dancing, just like moving his body. And then, like you said, there could be this judgment to it, right? Maybe from an outsider's view, maybe is that person has some mental health issues, or is there substance use happening here, right? Like there can be that judgment. And yet the cops went up to him and he was totally chill about the whole thing. He's like, I'm just moving, like I'm not doing anything illegal here. I'm just like moving my body. And the cops laughed and he just kept on doing what he was doing. So, but that actually made me think about that too, about how like we can get into this place of self-judgment. So we are with ourselves the way we are with other people. So if we're likely kind of judging someone for that, we're likely going to be judging ourselves for this very same thing, right? So being able to get into this place of feeling free to be able to be and move within our body. Um, what would you call it again? Bodyfulness, right? Just kind of absorbing that aspect of bodyfulness and having it be okay and just kind of like learning how to let go of our own self judgments. Because then again, when we're talking about that social aspect, right? If I can be less judgmental with myself, then I'm going to be less judgmental with others, which allows me to, enhance maybe some social connection.
Isn't it amazing how much, our body has been suppressed and our natural, self-expression has often been suppressed? And like you said, in that instance, like people who are being policed and, oppressed. In some ways, if you look at it, that way, it could be, seen as that. And so, it takes all of us to really, reflect and, you know, be vulnerable and like be open to exploring all the parts of ourselves, right? And, um, you know, being intentional about ways we show up in the world. So, dance movement therapy is a great way to destigmatize, um, you know, everyone's unique experience, lived experience, and break down some of those systemic oppressions that occur in society, and on a personal level too.
Yeah, and to your point, right, when we're anytime, because again, right, this is a psychotherapeutic approach, and so anytime we're in a psychotherapeutic setting, right, we're going to strive to create kind of like this safe haven, right, for people. And in fact, what the things that we get to kind of practice and go over in the therapy session, right, we kind of then try to make that feel safe and judgment free, so that then the person can go out and practice things on their own, right? And so that's ideal. And so, speaking of judgment, right, and even the way we've learned or how we were taught about movement, like I can remember when very vividly in my mind, I was probably about 8, 9 years old, and Michael Jackson's Pretty Young Thing, right, was out. And I remember being in a room dancing to that song, and then someone walks in, and then I'm like, oh shoot, am I doing something wrong? Like I had to stop, right? So even at a young age, I learned that movement in my body somehow, like if I got caught or somebody was watching, like somehow it was wrong. Somehow, I don't know how I got that idea.
That's a great song, by the way, too. And exactly, right? We are taught from a very young age, we internalize messages about what's right and wrong. And we learn from a very young age, right, that we do things because we're told to do them or because this is how it should look. And that's wrong, right? And so we have to be able to relearn, why are we doing this, right? It was, maybe out of curiosity, right? How it makes us feel, right? Of course, there's certain limitations that we have to kind of apply to certain situations, right? And adapt. But it's really important, especially for adults, to learn how to play again and be creative and, ask themselves, like, why am I doing this? Like, because I want to or because I was told to do it. And so that's really important. And also for kids to be able to express themselves and engage in playful activities, because that's where a lot of learning happens.
Yeah, I'm glad you brought up the aspect of play, right? Because what did I do when I actually, not only as we're talking, remembered that experience, but then also when my partner and I were at like a Home Depot the other day, well, I heard the song come on too. And so then I was literally showing him in Home Depot how I was doing those movements to the dance. So I was like, screw it, I don't care, right? Just like freedom, right? Free to move ourselves, right? And so this aspect of being able to kind of like release those constrictions from ourselves, right? That can have such huge carryover in other ways of our lives that we may not even imagine. Like, oh, that might just stem from like learning how to incorporate dance or movement into our lives.
Yeah, it's beautiful how we can find that avenue and then really just have such a more rich life experience.
Yeah, yeah, and not take ourselves so seriously, right? And so, like you said, right, sounds like this can be applicable for, it's fun for all ages, right? 101 or group settings. Can you talk a little bit about that and your experience in doing this work?
Sure. So group settings, it can be, you can use DMT, in clinical settings with groups, as I did in my training and early professional work. Before I got into private practice, I was working in a psychiatric hospital, a locked unit. A lot of people were depressed, but also like, really isolated and just kind of, having their own, they may not have been in in touch with reality always, right? They with dealing with psychosis, severe mental illness. So it can be really grounding to get people together in a circle and like have people, put on music or with props or not, and just kind of guide them through movement, ask them how they're feeling, and then try out a movement that describes how they're feeling, and then repeat it back towards each other. That can be really grounding and really therapeutic. That's kind of the one of the typical interventions you might see in group settings. Um, and and then that there's so many other ways that you can use dance movement therapy in the ways that it looks. Might be mirroring with another person, like what their movements are, or helping them create a dance that they can perform or share with you to represent something that they're going through in their life. So there's just so many ways that it can be done. Group work is great. I am starting to do workshops and community groups to help anyone, whether it's something, a mental health issue they're going through, or just they want to, like we said, be more creative, express themselves, release emotion. So it's just a great outlet. And then one-on-one work in my private practice, it's blended with the talk therapy. Often it's blended with when clients are coming in and processing different issues. Um, we might move together and then talk in a single session, or we might have specific sessions that are more focused on dance movement therapy.
In the bio intro, going back a little bit, right, that we read earlier, it said that to discover new pathways toward healing and growth. And I don't know if this was intentional, but I think neurological when I read that, right? Because whenever we're talking about learning new things, like we're literally like it's the neuroplasticity of the brain, right? It's like literally rewiring. My R's and W's are hard. Sorry. It's literally rewiring the brain, right? So to develop these new pathways. And I was thinking about that because when you were talking about persons like with trauma, right, or schizotypal features, right, like how that kind of cross wiring, kind of rewiring process kind of aids in this aspect of healing.
Yeah, exactly. It is intentional. Yeah, I think the field is intentional about, kind of that language too, about pathways and neurological processes. And some of the great research we have on dance movement therapy is related to the neurological components now. And so, when you are talking with someone, a lot of the information you're exchanging is the nonverbal communication, the affect, the facial expressions, tone of voice, of course, but the movements, the way we feel in our body, that's all coming up and is important information. And so dance movement therapy helps people reenact and helps them communicate um, more effectively and can maybe assertively, and also helps people de-escalate in conflict. And so dance movement therapy can be a really cool approach to get people to notice um, ways that they can, show up differently in relationships, as I said before. And then the neural connections that are being made when we communicate together, right? That are always happening, the mirror neurons. So as you touched on, that's, yeah, definitely a part of the new pathways that are being developed. Because meditation is great, but if you are just kind of like sitting and having an internal experience, that's only one way of making mind body connection. And we always try to encourage people to like actually be active and do things that are going to make more connections.
Yeah, it can be a great way to externalize, right? Whenever we're talking about trying to internalize stress, right? Some people might, suggest journaling or exercising, right? Dance can be another way to externalize that, right? Like you said earlier with the creative arts, so it can painting and music, right? And so, what I was also curious about is during the course of your work, like are there any like aha moments or some aspects of your work that you'd like to highlight that you feel would be important for people to know?
Yeah, I think one aha moment I've had is that people are not always fully aware of their full body experience, and before trying dance movement therapy, they know, like, functionally, what their body does for them, but on a expressive level, what it does for them, that is really eye-opening. And so clients often realize that, if they're going through something really difficult, they can heal themselves if they have support on it or not. They can use their own body movement and sensory experiences as inner healing resources. And so, you know, not feeling like you have anyone to lean on, like you realize that your own body becomes a support to lean on. Like, where if I'm know, feeling like really down and feeling a lot of weight in my body, right? Because I'm depressed. And then I can, hold myself, like hold my, rest my head on my knee or, give myself a hug, right? And notice how my body expands and contracts when I breathe. And, that can be really effective in how you can use your body as a healing resource.
Nice. Yeah. I mean, naturally, right, we're social creatures. And so I often will like, rely on other people's experience, to kind of like get me through some things. But to your point, right, we also like when we're working with individuals, we encourage and want to promote this sense of autonomy and agency, right? And so to be able to help people see like, oh, they can tap into this like inner resources, right, that maybe that they didn't know was there before can be huge.
Absolutely. And I will also say that, sometimes in my sessions or in my workshops, I will have people move together. Sometimes, like, one person will move and maybe close their eyes and, just kind of, move without, feeling like they're being watched. The other person will follow their movement and reflect it back to them. And it can be really, really interesting to see like how people, really have a personal connection to seeing someone else move. Maybe they didn't realize like there was something in themselves that they identified that they weren't aware of, and so um, that can be really powerful as well.
I understand you have an upcoming event. If you could talk a little bit about that, like what is it, who can come, what can people expect, that sort of stuff.
Definitely. My next workshop is called Release Through Movement. It's an expressive dance movement therapy workshop held on Friday, November 14th at 6:30 p.m. It's an hour-long workshop. It's located at Art Bias in San Carlos, and you can find tickets available on Eventbrite. I recommend it for all ages. It's really open-ended in that I will guide people through some movement prompts and teach them ways to release emotion through dance and movement. And then I'll give them an opportunity to explore what release means to them, whatever they're wanting to work through. And then they'll have an opportunity to create a dance phrase that they can take home with them and use on their own or with others.
Awesome. So again, they can go to your Instagram page to check out more information about that too, right? And so as we kind of wrap up here, Nate, like what are like maybe two takeaways that maybe you would want listeners to understand or perhaps even integrate after listening to today's discussion?
Well, everyone can benefit from dance movement therapy or DMT. You don't have to consider yourself a dancer. You just have to be open to experiencing what you're feeling, sensing, and how your body naturally wants to move. And then also, all movement is meaningful. So, you know, it's about what is meaningful to you. And it might be different for everyone else, but that can be a window into self discovery or new or healing.
Awesome. Well, any other kind of thoughts or insights that you can think of as we wrap up here?
Just that, therapy is really for everyone. And, I would encourage you, if you feel like this is a time in your life where you're wanting to start therapy, dance movement therapy can be it's a non-traditional type of approach. And so it can feel maybe a little less scary to know that, you're in the driver's seat with your life and in therapy too, and finding a therapist who's really person-centered and is curious about you and the path you want to take. Um, and everyone can benefit from that. And yeah, give dance movement therapy or other creative arts therapies a try and, see, you may be surprised what you might find.
Awesome. Well, great to have you on this week's episode and talk a bit about dance movement therapy, and all the best on your event on Friday the 14th. I'm in Los Angeles, so I won't be able to make it, but hope you have a good turnout. And thanks again for joining.
Thank you for having me. It was a pleasure.
Thanks for tuning in this week. If this conversation resonated with you, follow Now Serving a Site of Therapy on YouTube, Spotify, Apple Podcasts, or wherever you listen. Be sure to click subscribe and leave a comment and share with others who may also enjoy. Check out our website at izotherapy.com, where you can contact us to be placed with a therapist who's the best fit for you.